the ad hoc committee to order today. Roll call, we have 3 board members assigned to the committee who are all present. First thing I would like is a motion to approve the minutes from our last meeting.
So moved.
Second.
Thank you. Any discussion? All those in favor say aye.
Aye.
All those opposed? Then we will need to approve the agenda as posted. So motion to approve the agenda.
Motion to approve. Second.
And seeing a second from Brian. All those in favor say aye.
Aye.
All those opposed? I would like to note that there was one public comment received that was forwarded to everyone on the committee before the meeting. And that takes us into the actual agenda where we're going to review some progress on our principles and the dashboard data. So I'll turn it over to you, Randy.
All right, thanks, Dave. Yeah, this is the part where we're just going to review what our data looks like. Sent off to every committee member was the data in electronic format. I'm just going to turn it over to Kurt to talk through just basically the high level of what our data is telling us.
Sure. Rebecca, you want to pull the table one, this one? Yep. We'll start with the district data. Again, this table reflects the number of students who've tested positive, staff who've tested positive, and close contacts for each of those groups as well, and then how many have cleared, who have cleared to return. You'll notice that the bottom line is that, again, this data is taken on Monday, yesterday. If I would have taken it today, we would have nobody who is out. The 20 students reflected as being out on Monday were back today. So we've had very little activity really since the last time we met. That was kind of the stabilizing point, and it's been quite low ever since then. If you go to table 13, Waunakee table 13, as you can see during that May 25th time to yesterday, the numbers have been on a daily basis. The number of positive cases within our community, school district community, is quite low. Many days are zeros. So, all of our trends are extremely positive, and there just isn't a lot of active cases within our community right now. And then if you go to the Dane County Table 2, the very last one, you'll also see that that's true within the county as well. It's just a steady trend downward, where last week it was reported that there were 14-day average was 19, which it's not been that low since probably the first few days of the pandemic, quite frankly. So it's just very low right now. And again, it's the vaccine is working. I think this just shows the vaccine works. So that's kind of the data. I don't know if anybody has any questions or not.
Do you know how many tests they're actually doing now?
Yeah.
On a daily basis?
Yep. On that chart, on table 13, or I'm sorry, yeah, on table 13, if you add the first two, like for today, it was 7, or yesterday it was 7 total tests were administered in the county, or in our community. So it's very small.
I think it's important to note that when you look at the table from when we first started tracking last year, we were tracking at about a 14-day burden rate.
Mm-hmm.
It's just over 5. And June 2nd was the first time we got below 5 in the entire year. Mm-hmm. So to think that we've finally gotten below September's numbers,
Yep.
that's probably a good sign.
Yep.
Any other questions for Kurt? Okay, and And Dr. Potoff, what's kind of your view from the clinical side as you look at the data of what you see coming through your world?
Yeah, I mean, the data you're sharing tonight would be what I would expect it based on what I'm seeing in the health system. Generally lower disease burden in the community, not zero, but lower, and a trend that seems to be heading in the right direction, especially as we see more people get vaccinated.
Okay, very good, very good. All right, any other questions for Kurt or any questions about the data pieces? Yeah, that's all great news. Is it going here, Dave? Yep. All right. Some things internally, just kind of a report for the end of the school year. It's been a great end of the school year, especially the last month. I know, Jenny, you've been really active contact tracing this last quarter, and the last month has actually given you a breather from all that. So as we look back, and Kurt was talking about the number of kids we've had in quarantine, the number of positive cases in the last month was, you could count on just a couple fingers. So I mean, that was really positive. It really was able to make the end of the school year as much as normal as possible from an instructional standpoint and keeping kids in school, which we were extremely happy about and appreciate everybody's support and flexibility as we went through that. As we walk into tonight, what we're really doing is planning for the future. We're looking at what we can be doing for summer school, and I think then from a summer school perspective, that'll lead us into a conversation that I would anticipate that we'll be having with the school board and in the August timeframe, really looking at how we start next school year. So, but tonight is really a focus on how do we kind of move forward. We have summer school starting on June 21st. That's a 6-week program. About 80% of the students who are in summer school are in grades K through 6. About 20% are 7 through 12. What I want to do is I'm going to pull up a sheet that I just put in front of the committee. So Rebecca, if you can just pull up the one that I had shared with you earlier. This doesn't hit every single aspect of mitigation, but it certainly has some of the pieces that I want to talk about tonight as we kind of move forward as far as what we're going to be looking at for summer and then getting some feedback on, particularly where I believe we need guidance from the committee and some perspective is with regards to face coverings. But the first thing I'm going to do is I'm going to come back to face coverings and do that one last. So Rebecca, if you can just scroll up a bit for me, or I can control it here, I guess. That'll be easier. We're going to take a look at a few different things that we've put in place and from an operational standpoint this year that as we've met administratively and reviewed kind of our processes and practices and have seen how things have shifted from a public health perspective, we believe that there's a different route that we should go for the future. So we want to kind of lay that out for you. Just as a bit of review, we did have a public health order that expired last week. That public health order, those had been renewed every month for the last probably 6 months. And this one was not renewed. So now we are under a situation where there is no public health order requiring any actions. It has recommendations, but it does not have anything that is a requirement. So I think that's just a piece that as you've kind of looked at kind of how things have opened up in our region and our county, that's directly related to some of the pieces as far as the flexibility within not having an order, particularly articulated by the low numbers that we're seeing across the county. But as we look at kind of what we want to be doing as a district, there's a few things that we feel it's time that we can move away from. We've been doing a student and staff health check form every day since we've had students in school. Our reason for doing that at the onset was because we needed to make sure everybody was very cognizant of what the symptoms of COVID were. There were also some requirements in our health orders that we needed to make sure that we were clear about that, and this was one way we could do it. The second piece that reason we kept it was we felt it was just a good reminder to us as parents as we filled it out every day. And in my household, we filled out 2 of them every day for my children who came to school. It made you kind of think about were they well, what was their temperature, did they have any symptoms? It really made you cognitively think about that as you signed on the line and sent your children with that form. I think what we've seen up until now recently with obviously very low incident rates, we feel it's time for us to be able to move away from that. I think everybody is aware of what the symptoms are that we're looking for, and we feel that we can communicate that out to parents, that if you see those symptoms, please keep your kids home. But we do not, and same with staff. But I don't think we need to have a daily form that we are checking and collecting at the door any longer. So that's a process that we will be kind of recommending to the board that we move away from. Another piece that is evolving for us, and it's just evolved over the last couple of weeks here, is with regards to close contact and contact tracing. When the last order expired last week, we just kept all of our processes in place because we had 4 days of school left. We felt that was easier than trying to communicate out anything that changes. But there are changes that we do have ability to do with close contacts and contact tracing. Some of this is also in relation to the data that Kurt was sharing. The first thing is with regards to quarantine. There is a new piece that if you're fully vaccinated and wearing a face covering, and if you were deemed to be a close contact of someone who was positive, that you would not need to be quarantined. And that was a piece that's very specific to schools. And that was a piece that we feel that we are able to implement and would like to be implementing moving forward. The second part is if you're not fully vaccinated or we're not wearing a face mask, and you were a close contact, you would still be, per public health, under that 7 to 10 day quarantine, similar to what we've operated with for the last part of the school year. The one change that we have seen is that public health has articulated to us that they will be picking up more of the contact tracing. I mean, we've really been in the contact tracing business most of the year, and our hope is to really get out of that business because that's not really where we want to be. And it's really a place where public health has a place and a role to play in keeping the community safe. The only reason we got involved was because numbers were so high they couldn't keep up. And what they've articulated to us is that they will be taking on more of that role moving forward. Doesn't mean that we won't be involved as there's cases and they contact us, but we don't need to be the front lines for that any longer. So from our perspective, it's looking at, we don't want to be quarantining kids unnecessarily. We feel that, and Kurt and I have advocated to public health at different levels and with DHS on that issue. And we feel that this is really the place where we anticipated it going, was because we don't see the spread in schools as there are close contacts, particularly if the kids are wearing a mask, we don't have to quarantine them. So I think that's a very positive move in a great direction. And then having public health take on some of that contact tracing work. The other piece is then we've had a very robust communication system, probably to the point where we've probably annoyed people with the number of messages that came out. And that's some of the feedback we've received from parents. Last number of weeks, we haven't had to send many of them. And we feel that right now it's time for us to kind of change our communications pieces, particularly going into the summer, and really articulating and communicating to any class that has any level of an exposure, but not needing to really send those out district-wide any longer. Particularly since I think the most important piece of that communication is to the people who are most closely connected to it. And I think our numbers are at such a low number, it's really a communication piece to make sure that we are keeping those families that are most directly impacted informed. The other piece is with summer, not everybody's involved in summer school, and trying to kind of break out in a difference as far as an email that comes out from Annie that goes to the whole district. There's a lot of people that would be informed that aren't even a part of the program. So I think at this point we can kind of move forward with a few changes in our communication protocols. And then the last piece is that data that we've been sending out. I mean, it's very effective when we can do it by school and follow it when we have the majority of our students in place. With summer school, we'll obviously kind of continue to watch kind of what our data is on a basis, but as far as keeping up the robust dashboard, we probably will move away from that because I think our numbers are really showing that those numbers are very low. We can also take a look at the county numbers at any given point in time, and we're watching that dashboard become less and less prominent on the sites that we're watching. So from our perspective, those are some changes that we feel we can make just kind of moving forward. I think that's all good news. We all wanted to kind of move away from those processes. We put them in place based on input from this committee. So I guess I wanted to start and see if anybody has concerns or thoughts or perspective on kind of what we've laid out there as far as the health forms, the contact tracing, the close contacts, or the dashboard, before we get into kind of the bigger topic of face coverings.
I agree with that.
Yep.
It's, you know, the numbers are going down, and, you know, it seems like we get out of that.
Yep. Okay, thanks, Jack. Anyone else?
Is there a point that would trigger going back? I mean, if we do drop down, which is fine.
Right.
If there is any type of surge or any type of growth, what would be the point where we would start looking at it?
I think there's a couple things. I think picking up the data is relatively easy if we really wanted to kind of start to move in that direction, if we saw some reason to do so. I think even from a contact tracing piece, if there was something that sparked in any location or in the district, or if there was some sort of a surge that took place, we definitely have people who are trained, and we have people who are with us this summer who could help us with it. So it's not that we are without people to be of assistance. It's just, I think we're trying to put their focus back on the core work that they were hired to do and try to move them away from that. But if we needed to engage them, we could. So I think on all of those counts, there's opportunity to scale back up. We know how to do that.
Mm-hmm.
But I think right now it's just trying to get to the point of how to scale back down to where we believe we can be on all of those.
Yeah, so this is Jeff. I think you guys are good here. I don't think at this point in the pandemic, the daily self-help forums are going to offer a whole lot. A lot of that was like education, and we had really high numbers at that point. So I think you're good there. And as far as close contacts, I think it's good. I think one thing you might get questions on is in any exposure, there's two people involved. Yep. So when you refer to face mask, are you referring to just the person exposed or the person doing the exposing? What's the face mask? Are they both masked at that point? There's not much risk. If the exposer is unmasked and the exposee is masked, there's some risk there, although you could probably even talk me into saying that that's okay. And then clearly if they're both vaccinated, well, then there probably isn't an exposure, but that would be really low risk. But when you talk about face covering, you talk about the person exposed or the person doing the exposing?
Yeah, I think we were initially talking about the person who would be the person who's exposed. That's what we were looking at Kurt and Jenny, because I believe that was what our conversation was. The person who's doing the exposing, means certainly that would be a person that would then be removed and quarantined because now they have been viewed to be, in that case, COVID positive. They'd be the one who'd be quarantined, but the person who would be face masked and would have been the close contact or been exposed, I guess our interpretation is that we would not have to quarantine that individual.
Right.
Yeah.
Obviously communicate to the parents of what happened, let them know to watch for symptoms, but that would be our perspective.
Yeah, no, that works.
And I think in general, just the whole reinforcement with parents and staff that if you're exhibiting symptoms, really of any kind, you probably need to work with your healthcare providers to figure out why you have symptoms, because there's probably some follow-up that you may need to do. And I think just emphasizing that monitoring of symptoms is the important key that needs to continue forever, whether COVID existed or not existed. Because what we dealt with about 3 weeks ago was a strep outbreak. You know, we had strep that was just running pretty rampant. And, you know, those other illnesses are still around. They haven't gone away. Just because COVID is getting all the headlines all those other things still exist, and they will continue to exist and come into our schools. So monitoring your symptoms is important, and making sure you're not coming to school until you've had a chance to figure out what's going on.
Great, thanks, Kurt. All right, any other comments on this part? Thank you, Dr. Potoff, for that feedback. That's very helpful. All right, let's go up to the one that's a little bit more difficult. This is the one on face masking, so I'm going to go up here. Whoops, where am I? All right, so let me start off with a little bit of a preamble to this, then I'd like to open it up for some feedback on it. I also had a chance earlier today, I know Dr. Random and Dr. Anderson are not able to be here tonight, but I did have an individual conversation with each one of them, and I can share their perspective after we have our discussion first. First of all, the face coverings piece obviously has become a large national conversation as of late. It's probably been all the way through the pandemic, but certainly now that we're coming to where a lot of people are getting vaccinated, the conversation is really surfacing as far as what should we or shouldn't we be utilizing face coverings, and what's the effectiveness of that. I think we've had that discussion around this table throughout the pandemic, and I believe I understand kind of what our perspective was moving in. Right now, what we need some guidance on is how to move forward. And I'm just going to kind of summarize what I've heard as far as parental input on this, so you kind of get a perspective of at least some of the voices that I'm hearing. And I know some of the board members at the table here have also had some interactions with members of our community who've provided some input that was part of our public comments tonight as well. But I'm going to break this into really two groups, because I kind of categorize our comments per the families by the age of their kids. So first of all, the kids that would be going into kindergarten and 6th grade next year. So that's kind of your under 12 group. That's the group that really, at this point, is not eligible for the vaccine. And then the second group I'll categorize as our students who are grades 7 through 12, so our middle school and high schoolers. And that's a group that is eligible for the vaccine and has been for a number of weeks here now. In very general terms, I think for our K-6 kids, there's really two trains of thought that I hear from parents and pieces of feedback and advocacy that they have. One of them is asking us as a school district to require face coverings for students while they're inside and on buses, because kids they don't have access to the vaccine. So there's concern that because those students are not vaccinated, do not have access to it, that then part of our protocol should be to require face coverings and continue with that practice that we've implemented all year long, particularly at our K-6 grades. The other perspective that comes out from this set of parents is this should be up to parents. This is a point where we have low numbers, low incident rates. We have our communities are opening up. We're going to grocery stores, out to eat. We're having more interactions as a community. Things are starting to find their way back to normal, and that should be a decision that parents can make for their children as they go into school. And so that's the other perspective. So the two of them is, one, school should require them and maintain that because the K-6 kids are not eligible for a vaccine. The flip side to that is saying it's great if you choose that for your family and for your child, but please allow parents the option as far as how they would do that and send their children to school in their own expectation. The other piece of feedback that I've received is really around the 7-12, and I think at least of the communications I've received when I kind of looked at kind of the age of children that the families who were communicating with me on, I think there's just a general view amongst that group that many of those kids high percentage have been vaccinated, they've had access to it. So definitely the advocacy in that group seems to predominantly be that should be up to the family, the parents, and that should be more of an optional piece versus a required piece for the school. So that's kind of a piece as far as kind of how some of at least the parental advocacy and at least what the conversation that's being placed in front of us is. And I think our job as a school district now is to try to figure out what's our protocol moving forward, what should we be kind of implementing as our policies for summer school, which is a 6-week program starting on June 21st. what makes sense as a district, what's our responsibility to parents, and what's our responsibility community-wise. From our perspective, and this is kind of a conversation we've had administratively, but it's also pieces we've heard from working with public health. I think the issue that we need to work on is what are we going to do inside? Because we feel like if activities are outside, kids are outside, we can probably have that be an optional activity, masking optional, leave that up to the purview of the parents. I mean, I think we found that to be effective even as things with like athletics and other things as we've kind of moved forward this spring. So outdoors, really having face coverings optional, leave that up to the parents. Staff, I mean, I think that kind of aligns up a little bit closer to kind of some of the decisions we have with students. We can talk about that, and I think once we get feedback on students, we can kind of determine amongst us what we feel is kind of the next direction for staff. But we really need some direction as far as what are some thoughts on our K-6 students and our 7-12 students, particularly while they're coming to school for summer school and riding the bus. Should we be requiring that? Is it different by the grade levels as far as access to vaccine? Or is this something that we're really at a place in the pandemic where the numbers are low and the risk of allowing parents to make that choice as we operate our schools, we're at a place where we can open it up to that level. So with those kind of options out there, I'd like to open it up for some feedback. I do have the perspective of Dr. Random and Dr. Anderson, but I think it'd be helpful if we kind of start off with our discussion first, and I can share where they're at. So that's kind of a big one, but I mean, Dr. Potoff, is there a perspective you can share? I'm just going to lay that one right on you there for a minute.
See that Matt and those folks agree with me.
Yeah.
I think for your 7 through 12, so your kids who likely have had an opportunity to be vaccinated, that's probably fair, assuming that they've had access and if they wanted a vaccine, they could get it. And I think those are probably all true things here in Dane County. At that point, if you're unvaccinated, it's of your own choice or your parents' choice, and I feel that risk is fair game. Outdoors, you're probably okay. Outdoors close together, there probably is some utility in masking for those, less than 12, but I think it's not a likely occurrence. We're outside, you're all grouped together, so I think that's okay. For me, the K through 6, it's actually really easy. So those kids need to be masked until they've had a chance to get a vaccine. And the reason being is there's this misnomer that, if it's up to the parents and their kid wears a mask, they're protecting their kid. And if other parents don't want to wear a mask, they're risking, their kid. And that's not true. If you have parents making a decision not to mask their kids, that's actually throwing a really difficult decision to the other parents who now know that their kid is at risk in being in that environment, even if that risk is small and it's tiny and cases are low, because just masking their kid doesn't as well protect them against that kid who maybe does have the disease who's not unmasked in your school. And I think, from my perspective, my tolerance for even one kid getting really sick or getting MSI or C, that inflammatory disease, or sometimes need heart transplants, I just wouldn't risk it, especially with the idea that summer school will probably be masked. By next fall, you may have vaccine available for those kids. Get them all vaccinated in that first trimester, and then you can start having that conversation that looks more like your 7 through 12 grades, where everyone who wanted a vaccine had a chance to get it. The risk is super low for the vaccinated, and you're not putting parents in a situation where they have to decide whether they want to send their kids to school with other kids that could pose even a small risk to their kid, when it's just so easy to prevent it.
All right. Yeah, thank you, Dr. Potoff.
Hi, this is Valerie, and I'd like to comment as well. I believe there are students in our district, and we do have to remember that children are required to come to a school, and the public school is the big option for them. But we do have students who cannot get a vaccine due to their medical conditions and disabilities. And we need to remember that if they're required to come to school and we're not asking for masking, then we're putting their lives at risk. And so they're really in a conundrum of they don't have a choice in coming to school, because there are kids who it's not a matter of whether or not their parent wants them to get a vaccine. It's not a it's a life-altering question. The vaccine could be very detrimental for them, and I think we need to keep that in mind as well. And if Dr. Potoff has comments on that, I would appreciate hearing those as well.
I think my only comment on that is I think where those kids might do okay eventually is if there is high adoption of vaccine rates within the school-aged kids and you get to that 70, 80, 85% vaccinated, those kids who are either unable or their immune systems don't work to create that response will be protected by herd immunity. So I think that's something that you might be able to get to, but it is a consideration that both students but also some of your staff who would like to get vaccinated or got vaccinated and aren't mounting a response, there's some risk there. Clearly a smaller number of people, but don't necessarily want to marginalize them either.
Can I ask a question, Randy? Is there any mandatory classes this summer? I don't, off the top of my head, I don't believe there's anything where a student would be in a
No.
mandatory attendance.
No, I mean.
There are classes from required courses like math and whatnot, where if they want to get credit and or graduate on time, they need to. I don't know if that's the same as compulsory attendance though.
Most of those would be through 7 through 12 though, won't they?
Right. Yeah,
That
fair
would fall
point.
in the K-6 category.
yeah, those would all be our 7 through 12, it'd be some of our credit recovery students.
It'd really be 9 through.
9 through 12, thank you, Brian.
9 through, do I hear 10
Yeah,
through 12?
and I think.
Nine,
Going
12.
once? No.
And I believe a lot of that is very self-paced. It's kind of identified by the teacher, what is the student missing, and once they complete that, they're done for their.
Yep.
So those really aren't classroom
I
setting.
don't know if there are similar programs for elementary school,
You know.
but if there are, and even then, I still don't know if that counts as compulsory attendance.
That's probably the closest we have, and we have probably a few things with even special ed. Are there any extended school years?
Well, there are a few students who are, it's in their IEP that they have extended school year. But again, those are pretty much all individual. It's not a class. It's not a class of kids.
Right. Yeah, so I would say the answer to that is most of our students, that there's definitely, it's not a compulsory attendance, it's a required attendance. It's mainly supplemental, or it's supporting of their program to help them either get back to credit recovery or maintain skills throughout the summer.
But just to be clear, we're just, for the public and us, we're just talking about summer.
Right now, we're just talking about summer. What I would anticipate is I'd like to have this similar conversation in August, before the August board meeting, so then we can then put our plan in place for what fall looks like. But right now, we're just talking about summer, because that's the one that's right on the cusp of us starting here in a couple weeks. Any other kind of comments? I do have a few to share from others I spoke to.
I would submit, though, that the virus is declining. And having K-6 wear masks, in the buildings, I would submit that we could potentially remove that requirement.
Okay. So your perspective is that could potentially be an optional piece for parents? Is that what I?
It would be an optional piece, and if parents say, hey, I want to protect my kid, and, it's the parent's choice. Saying, you're going to wear a mask when you go to school, or you're going to wear a mask when you ride the bus. I think, when you start looking at the numbers and you really start looking at the community and how the community is, coming together and in buildings and things like that, we don't see dramatic increases, in numbers. So I think there's a lot more population that's interacting, with, in closer proximity. So.
Thanks, Jack. Other comments?
I would just bring up one thing that, we had seen already, but I mean, if we do have a family choice situation, we will, when there is positive cases and the child or the family has chosen not to wear a mask, we will have some conflicts and some family shaming and public shaming that has been going on already. So, I'm on the fence on this, but I just want to throw that out there that, so everyone knows that that will happen, and is that something really we want to continue, especially in an unvaccinated population at this point. I don't know. I'm just throwing it out there though, as a thought.
Since, as board members, we're not here every day during all your normal transactions and anything. If we created a voluntary process for case 6 and said it's up to the parents to decide whether that student has to be masked, that student comes to school, is with all his peers, and some of them are not masked, and they pull their mask off, and then suddenly they get quarantined because they didn't have a mask on, and the parent says, well, I said he was supposed to keep it on, why didn't you guys take care of that? Now you got my kid quarantined. I see that as a little bit of a potential downside when we're talking about, 3 hours of summer school?
About 4 hours. I mean, it's
3 to 4 hours total. If we make that optional, how much do we open up a parent who is expecting their student to be at school suddenly being home quarantined when they want them in a mask, but we couldn't tell the difference because we made it optional and we quarantined the kid out for 2 weeks. That's almost a majority of the summer school class. I'm just saying is that something that could be potentially problematic?
I guess that would be a what if, right?
Yeah.
But I guess what I would wonder as well is how many of these K-6 students have play dates where they're getting together, outside of school, and they're probably not wearing masks. You go to the park, there's not many people wearing masks. So I would submit that it should be optional, and if the parent wants their kid to wear a mask, while they're participating, then it's really the parent's responsibility. We got to get out of the policing of this stuff because it creates other challenges as well.
Yeah, to your question, Dave, I think it would be very difficult for us to be able to police and enforce that type of thing.
Right, I don't
know
think we can.
who it is. It's going to be, kids are going to have to follow direction, if that was the direction we went to, but we can't, particularly as kids have kids moving around throughout their program in summer school. I think that'd be very challenging for us and for our staff to be able to manage.
Well, if we followed what was written here, as an example, I mean, if they're wearing masks and there's a positive case, no, there's no quarantine.
Correct.
But as soon as a mask comes off,
Right.
so if you have 3 or 4 kids that are not wearing masks at school, then they're out.
If they were.
If they're not wearing their masks.
Okay.
So, and that's where parents would have to understand that, is they're taking that risk. So.
But I would also, when we look through the years, our K-6, how many cases do we really have K-6 throughout?
Positive cases,
Yeah.
case 6, it's about 50, 53-ish.
Yeah, and that's over the entire year, and, we had mass outbreaks, and, we were at the peak, when we had all those cases. I would think, how many of those cases have we had, over the last 2 or 3 weeks, when we've been on the or decline and so forth.
So I'm assuming that we would still have some sort of social distancing, maybe not 6 feet, but we'll have some, or we just mask up.
Right now, I see the social distancing piece. I mean, we're at 3 feet or less right now.
Right.
So I mean, I would see that it's pretty much starting to move. That's really much more back to normal, particularly elementary wise. They've really done We spread kids as much as we're able to, and I still think that's prudent, but for the most part, you have 18, 20 kids in a classroom. It's operating very much as a cohort. They're meeting in small groups, they're doing that kind of work, and that seems to have been effective. Let me share what Dr. Random and Dr. Anderson said, and just to kind of, not wanting to put Dr. Potoff on the spot. I mean, when I talked to Dr. Random, one of the things he shared with me is there's differences of opinion even amongst the medical professionals as far as how to go about this. And he was even sharing that within the confines of the folks he works closely with. There's slightly differences of opinion. So I'm just going to I've asked both Matt and Bill if I could share kind of their perspectives, and they gave me the okay to do so. What Dr. Random shared, and he was very consistent as kind of the considerations that he's provided to this group in the past, his greatest concern was about grandparents and spread in community. I mean, that's where he's been solidly since the very beginning of the pandemic, as far as mitigation efforts in school and concern about kids being carriers, taking it to grandma and grandpa becoming very sick. He feels right now that the grandparent population is generally very highly vaccinated. So he feels that that is no longer a concern of his. He feels that parents of kids are able to and have been able to get a vaccine at a high level, and it's readily available. So he feels that the percentage and the high rate of vaccination in the county has been very effective in keeping numbers down. His perspective is that the impact of COVID, even though, as Dr. Potoff and others have shared, can have an impact on young people. Generally, he feels it's more mild. And he feels that the chances and the risk of transmission is relatively low, and particularly as people are starting to get back to living their lives post the orders that have come out, and just watching things kind of open up over the last number of weeks. His comment was he feels that there could be an argument made to be more open and allow parents some options as far as face coverings. He did share that he goes, there's differences of opinions on that. That's just where he resides. Dr. Anderson, I spoke with him this afternoon. I shared Dr. Random's perspective. And what Matt shared was that the COVID numbers are low. He feels that the risk of another surge is also very low. The percentage of people vaccinated in our part of the state is extremely high and is continuing to improve. He felt that the grades 7 through 12, he was very comfortable with that being really an up to parents optional area. And for K-6, he said, even though that there is more risk factors there, just as Dr. Potoff had articulated, he feels the risk of transmission is relatively low, and feels that you could follow a similar type of a process there with having that as a parental option as far as how they operate. His one caveat to that was understanding, and this gets to some of the things like Val talked about, was we do have kids with underlying issues like asthma, etc., who would need to be very cautious. But his comment, I believe, also was that we have to be cautious with kids with asthma at different times of the year as well. I mean, I think both Dr. Random and Dr. Potoff, or Dr. Random and Dr. Anderson, talked about people are starting to get back to being more open with their social networks, and that there is a point in time where we have to learn to coexist with COVID, and that COVID's never going to go away, and it's going to be a piece that we have to figure out how we kind of live with and move forward with. Now, the conversation I think we have kind of in front of the board is, how does that all pair in with kind of knowing that there are a certain part of our population that's not vaccinated? And certainly COVID will be with us for a long time, but we do have some kids that, to Dr. Potoff's point, that are not quite there yet. And then we also have kind of the perspective that Dr. Random and Dr. Anderson bring, which is numbers are very low and risk of transmission is low. So I don't know if that provides us absolutely clear guidance. It kind of gives us a lot of things to kind of think about and figure out kind of where we kind of, I guess, put our perspective. But that's really where Dr. Random and Dr. Anderson were falling. That was their perspective without the benefit of this larger conversation.
Would we have do we have the situation where we may have a staff person who chose not to be vaccinated still teaching?
Yeah, we have staff that did not receive the vaccine.
And what do we tell them about masking? Would they be part of this optional thing, or would they be? Okay, I'm just asking.
Yeah, I mean, that's part of
It'll
the
be a discussion for
conversation.
Monday.
The
but-
answer is,
Yeah.
That's part of the, I mean, and I think part of the discussion that falls into here is there are some folks that it's, regardless if it's now or if it's November, how does that change as far as their vaccination status? I mean, some of them certainly are not being vaccinated because of some health areas. Some of them are for other personal reasons. So there is a kind of a part here as far as how do we kind of move forward at any point when you have choices that are made.
What is our vaccination rate right now in Dane County?
I think countywide, we're like 67%. I think that's what I saw this morning.
and that's both shots in the 2 weeks, right? If I recall. Yeah.
Yeah,
67.
so we're close to their herd immunity type discussion. Is
But
that
this summer, everyone's traveling, so it's just not
Right.
staying in Dane County, but.
The funny thing is, and maybe
I'm just
Dr.
over
Potoff, you can help explain something to me. I initially heard herd immunity was 90%. And it seems every week the number keeps going lower and lower. Is that because we figured something out, or is it because nobody thinks we're gonna get to 90%? I guess is my cynical.
Yeah, no, the numbers changed a little bit. A lot of it is natural and vaccine immunity, like how good is it from preventing disease? So that number's decreased as the vaccine's been proven really effective. I think the other thing to know about herd immunity is it's based on a concept of an even distribution amongst the population. So even if Waunakee had 90% vaccination rates, but 0% between the 2 to 11 group, you wouldn't have herd immunity within that group. They'd still be at risk of transmitting the disease. So that's just one thing to keep in mind, is when we talk about that percentage, it assumes an equal distribution amongst the population, not say really high rates in an elderly group, but really low rates in a different group. You wouldn't necessarily reap the benefits of herd immunity at that point.
Thanks, that makes sense. What, I'm not sure, I don't want to obviously reveal information we should not, but what is our staff percentage rate at? I mean, are we talking a fair number of staff that is not vaccinated, or?
Well, part of what I would answer that, Dave, is that I can't give you an exact number because some individuals chose to pursue it on their own. I would say that from what we offered to our staff, we had approximately 80% chose to be vaccinated. But that number would unquestionably be somewhat higher because some individuals chose to go outside.
So we're 80 plus.
Yes.
Thanks.
In regards to our community, and I think this is the question you asked, Jack, on Friday, we hosted a public health vaccine clinic at Heritage. And when they talked to us, because on Tuesday, they hosted one at the public library as well. So when public health, when they were talking to us and to the public library staff about hosting that clinic, they did share some vaccination rates by census tract. If you remember when I started the data, I broke the district up into the census tracts. And they shared 3 census tracts, which get the bulk of our residents. 2 of those census tracts were over 70%. One was like 71 point something, and the other one was 73 point something. The 3rd census tract they shared, which is why they asked us to host a clinic, was at 56%. So there's some disparities even within your community as to your vaccination rate. So overall, you know, if you take the 270s and the 56, it's a good number. But you did have this one census tract within our community that was significantly lower, 20-point swing to me is a pretty significant difference in your vaccination rate. So there are differences within our community. I just add that just so you know that when you hear 60%, you know, or 70% with, you know, within a county, you can have pockets that are significantly lower.
But it still seems that, you know, we've gotten rid of the requirements. Public health has gotten rid of the requirements. People are getting closer together. You see more activity. You know, and I suppose we're probably a week out to see if there's going to be a spike in cases. But, you know, we've gone through thinking that after Christmas we're going to see a spike. After, you know, all of these major things, we thought we were going to see a spike, and we didn't see them. And, you know, I get the point that we're traveling around more, but, you know, we're not seeing those big spikes that have been thought were going to come down the pike.
Mark, did you have a question? Sorry.
Dr. Popoff, I don't know if this question is germane to what we're trying to decide tonight, but do you have a pretty good guesstimate as to when the K-6 students will have a vaccine available? Are we looking after August? Is there a chance it can be before August? And how good a chance might that be?
Yeah, I think, you know, before August, I mean, there is a chance because they want to accelerate these trials. I think a safer bet is to say August into September, you'll have Pfizer available, a month or two later, Moderna available for that 2 to 11 group. So I would feel more comfortable saying August is fairly safe, but July, that might be pushing it. Maybe they pull it off, but July might be too early.
Thank you.
Thank you, Mark. Well, are there any other comments or questions so that the board has?
Yeah, I
Jenny.
just have thought of a couple of questions. One is in regards to this under face coverings for students going into grade 7 and 12. I'm trying to do the math, but could there be incoming 7th graders who aren't 12 through summer school or coming into summer school?
I think they would turn.
They would probably turn,
They should be turning 12 this
They
spring.
would be turning 12 when they
well,
were.
by September 1st.
Yeah, but that's if they opted early, right?
I gotta do the
I have
math.
a granddaughter who is going into 7th and she's 11 until August 4th.
Yeah.
Yeah, so there's.
Yeah.
So
there's a
something to
few of them.
consider that if we do optional face coverings for the 7 to 12, there could be some children who don't have, in that age group, who don't have the option to be vaccinated. And then my second question was regarding activities and athletics that could possibly start in August before a determination will be made for the school year of how, you know, would they fall under the summer school, whatever's decided for summer school? Or would that be more for the?
Like football starts in the first week of August or something like
Yeah, I
that.
think a lot of our things that we did, like for the outdoor things, is since it was outdoors, we allowed them to kind of participate without the masks, et cetera, this spring. Even the soccer and the lacrosse we did at the end. So I think that would probably hold true. I mean, volleyball would be indoors, but it's not a contact sport, so I think it's probably a little bit more open for during the competition piece. That's at least that's my off the top answer, Jim.
Okay, thank you.
But yeah, your point about the 7th grade is probably an age issue versus but I think it does hit some of those kids, but majority of them would turn, but there's definitely a percentage like you pointed out that would.
And the number of 7th and 8th graders who attend summer school is relatively small.
Right.
And they somewhere in the conversation talked about spacing, certainly at the 7 through 12 level for summer school programming, just because the numbers are smaller, there's certainly could be more distance between students, just because you're not going to have that many students in those rooms. 7 through 12.
It also impacts as we start to kind of lay these things out for summer. There are some camps that are run. Many of them are outside, but there are a few volleyball, basketball camps that are indoors that have different age groups. So, I mean, there's some pieces that what we talk about here also needs to then be part of what we would use as some of the protocols in some of those areas as well. So as we kind of, that's kind of the decision points as we move those forward on Monday. The impact is, yes, summer school, but I would also utilize those for some of our summer camps. Those are the ones that would kind of run between now and the end of July. And then obviously we have our own athletics, our high school athletics primarily start probably in that second week of August, beginning of August.
One thing that we were going to talk about that just came to my head because of this conversation was band camp, because they're doing some indoor activities with instruments.
Correct.
That was one thing that we were going to touch base on.
That's in August too, isn't it?
It's July, because it's prep for Waunakee Parade, I believe.
So it would fall under whatever the summer school decision is.
Probably falls under the summer school decision. I mean, we can do some of the, if we had to practice that outside, we have the tents to do so. And then part of what they're doing is learning the music to then march, and the marching piece and the formations pieces are outside.
And that would fall in all the grades 9 through 12, right?
Be 9 through 12, but we also have band lessons all through summer school across the board. And we do have the ability to do, even through the public health orders that came out previously, there was the ability to do band inside. We chose to do it outside. But there are options where you could do it inside with the split masks. But yeah, that would be a piece we have to kind of think through. So we can look at that before Monday so that we can have some direction.
Are there any other questions or comments? I believe we probably also covered vaccine updates under this.
I think we've already kind of hit all the items that I had on the agenda. I think the last part was, are there any questions that, I mean, the board members would particularly have that we need to, that it would help with kind of framing up this conversation next Monday? And certainly this is probably one of the, I guess it's more challenging, but it's got definitely different aspects of it for the decision point. And just trying to see that, make sure that we have what everybody needs in order to kind of formulate their position on it in their direction.
I know this is a lot more difficult to get together, and we haven't always used it as our checkpoint, just because we've been lucky to have great medical advice in Waunakee. But hearing what some of the other school districts are doing as ways to work around this might be helpful. I know you may not be able to get that in time. But you know, what's the Rona, DeForest, and...
Yep, and I have most of that already. I mean, I would say, I can just quickly summarize. I think you have, generally in Dane County, what you're seeing is kind of following what Dr. Potoff laid out. I think it's that the kids who are not vaccinated, maintaining masks for them throughout their summer school. Now, districts run everything from a 2-week to a 4-week to a 6-week summer school, so they're very different models across the board. You have certainly that model. You have ones that I think have gone K-12. You have ones that have articulated out K-6 because they're not able to get the vaccine, and then have an optional piece for really middle school and high school. You have a few districts in Dane County. I just learned about this afternoon that are really looking at more of the optional piece, or considering that, as far as leaving that up to some parents. And then outside of Dane County, I don't really have a very good sense of what that network I'm not as tight with. I mean, I've looked up a few things, but I haven't been able to see really some of their protocols. Some of them it just states we'll make a decision before summer school comes. Some summer schools also don't start till July in some districts. Some go July and first weeks of August, so everybody structures it differently. So the timing of decisions aren't necessarily the same as what ours are. But I would say generally, Dave, across Dane County, it's relatively consistent trend of looking at elementary kids being masked throughout their summer school, and in 7-12 it being more optional. And there are some school districts that have taken a different path and made it optional across the board.
Well, I guess I'll give it one last chance, especially for the board members, if there's any information they want or have any questions, this will be our last chance before our next board meeting to make sure we can get that. And of course, for the medical people, if you'd like to make a last comment, I appreciate it, just as we totally appreciate that you guys spending your time helping us get through a very tough year. Well,
Yeah.
Jeff is so smiling. I mean,
It's great that we actually have like our first, like, I don't call it disagreement, but, differing opinions on something related to COVID. That means that we're in a pretty good situation and you're really just trying to figure out what's your risk tolerance, which is then funny that the primary care docs are more risk tolerant than the ED doc, but we'll leave that discussion. I think the other thing, I don't know if it matters, we get flagged on it, but if we look at CDC guidance would still recommend that those unvaccinated kids be wearing masks in public places. So to make that optional would be against CDC guidance. But I really think it just comes down to that risk, which is clearly small, but for one kid could be catastrophic. Is that worth wearing a mask for all our kids in summer school for 3 hours a day, knowing that, one parent deciding to wear a mask, another parent deciding not to wear a mask, that parent that decides to have their kids wear the mask is not getting the same protection as if all those kids were wearing the mask. It's really the exposer who needs to be masked, not the healthy kid. So that's where I'll leave it. And this has been super fun. So I'm really fine if folks want to disagree on medical opinion. Like, it's finally getting to that point where we're getting to, pretty nitpicky stuff.
well, Jeff, that does bring up an interesting question. When you brought up the part about when we look at quarantining, wouldn't it matter more if the exposer had a mask on as to whether we should quarantine the exposee?
It does.
I was a
So
little surprised that that's reversed.
Yeah, I would say the benefit is 80-20. So 80% of the benefit of the mask is covering the mouth of the person who has the virus. 20% of the benefit is covering the mouth of the person who doesn't have the virus in an attempt to prevent contracting it. So it's always the exposer that is benefited by wearing the mask. That's why it's not as easy as saying parents decide, because you don't know if your kid's the exposer or the exposee, and your risk is still there if you mask your kid and your kid isn't the exposee. But if the parent doesn't mask the exposee, all those kids who are wearing masks take on a fair bit more risk.
All right, thank you. We do have to cover future meetings, and I think Randy already briefly mentioned that probably the Tuesday before our August board meeting would probably be the best time for us to meet again, roughly the same time. That way, again, we can get the information, get the input, so the board will have it for the August meeting.
The date.
I didn't look.
So the August meeting is August 9th.
So that would be the 3rd, August 3rd then, would be that meeting. Does that sound okay with everyone? And hopefully, absolutely nothing will happen.
I won't be here because I'm retiring on June 30th. So I
No,
won't
we're
be
gonna let
here.
you come as an honorary committee member.
There it is.
If we can do that, hopefully that will kind of serve as one of our last meetings. I think that would help give us the guidance we have as we kind of come through the rest of the summer. So if that date works for everybody, we could do a 6 o'clock meeting and you can watch it live.
Sure, I'll tune in.
Yep.
All right, then I take a motion to adjourn.
Motion to adjourn. Second.
Thank you. All those in favor say aye.
Aye.
All those opposed. And again, thank you so much, Dr. Pawlowski and Jenny and Sarah, for your time this year. And hopefully there will only be one more time.
No, and thank you guys. I mean, you did good, right? I mean, this is a success story. You had more school than most other places, and you did it well, and you did it safely. So, kudos to you guys.
Thanks,
Thank
Dr.
you.
Pawlowski. Thank you, Aaron. Thanks, Bill.